Just from the get-go, from that very first webinar, I just knew I really enjoyed, and it was very informational. It kind of, I mean, that really was the selling point. We did talk to some other consultants, but I mean, HealthLinx, it was a fit. It just fit with our culture and our goals and what we needed. Believe it or not, Lexington Medical Center is actually a local single entity community hospital. We are not part of a system. We are an individual organization, standalone. We have 607 beds. We do about 90,000 ED visits. And then we have 6 community medical centers, which is 3 of those are ambulatory surgery centers. And then we have 6 urgent cares throughout our community. And we're growing. We're opening a new floor here in the next years. And then recently, we also begun a graduate medical education program, and we built a nursing campus for the University of South Carolina College of Nursing. On our campus, it has just been exponential, the amount of growth and change. And in all of that, we've had very good leadership from our senior team as far as strategically aligning with goals for the future to be successful and to maintain, our community culture, as well as continue to grow the services that our community needs. When we did our assessment, kind of a big aha moment was like nobody knew our care delivery model. That we do great care, but nobody could attach a name or a picture, the PPM graphic to it. And so pulled together a group of clinical nurses, and we sat down, and we liked the structure that we used for our professional practice model, but we needed to update the graphic and kind of give it a face. Another area that we really needed to enhance was our research. With COVID and some transitions, with retirements and such, that committee had not been active, and so we needed to kind of pull that back together. Our IRB, they shifted, and there was a whole organization restructure as far as where that department was reporting through. And so they were new at it. I was new at it. It was kind of like we're all figuring out what we needed to do. And that's been a really fun journey to learn and get excited about nursing research. We hadn't done an official annual nursing report in many years, and so we kind of had to resurface that and bring that back to the table. A lot of work that had to be done at the grassroots level was the strategic plan, and aligning that to the organizational strategic plan, and what is your part in that, which then tied into our professional practice model. So it was this great, just circle of events that everything is so interconnected, but you don't think about that in your daily work. And so it was just connecting those dots and realizing that, we do it. We don't talk about it, and we didn't have a structure for it. And so those were heavy lifting projects. That has definitely been one of the most rewarding things, is just to hear all the wonderful things that are happening throughout the organization. I mean, our site visit it blew my socks off. I mean, I know the appraisers were wowed and impressed, but it's just but it's another thing to really live it and see it from a different lens. And so rather than just reading it on a piece of paper, it's not just a number. I mean, there's a person behind that number. And our CNO had started as a nurse tech, and she's been at Lexington Medical Center for, I think, 35 years. But with our magnet journey, she was much more visible. She was very active in our journey and very approachable. She attended our magnet champion meetings and had open forum discussions with staff, and just very approachable. And so the journey definitely helped get her more visible to the staff throughout the whole organization. We had 7 exemplars. Our certification for the organization level and the unit level both outperformed. Education with, nurses with your BSN or higher, again, we were the top of the spectrum for that. For RN satisfaction, I know it's not a surprise after what I have been sharing, but we were at 82% of our units that outperformed all of the categories that we submitted.